Good afternoon. What a pleasure it is to come back home. I bring greetings from sunny Los Angeles. Sunny Los Angeles. um, I have to obviously thank Dean Daly and the administrative staff here at Harvard Medical School and all the friends and actually I think my daughter's in here somewhere. I was going to say family, but I think there she is, for coming. This is a pleasure. It feels a lot like a homecoming. And your superstar, Joan Reed, is somebody I have to especially thank. I don't need to tell you about her work nationally and the ways that she supports and prods the rest of us across this country with her cutting edge strategies. So Joan, thank you for inviting me and for this opportunity. So I do have some things to share, some thoughts and ideas. You heard a lot about these three men, and so I won't repeat any of it, but I do want to say that what this knowledge means to me um, is actually a little bit humbling when I think about us as a society and how fragile some of our gains are. So you read this history and you appreciate some of the strides and the accomplishments of that day. And then you think about the civil rights movement and the accomplishments there. So for me, this period of time politically and nationally just reminds me how fragile many of the accomplishments that we have made as a society actually are. So thank you, Harvard Medical School, for remembering, for lifting this up, for giving us an opportunity to recognize that we have to continue to struggle on a regular basis to maintain the good things that have happened here, not only at Harvard Medical School, but in this country. Some very, very good things have happened around race and class, and maintaining that and going forward means we have to continue to fight this fight. So let's talk a little bit about the subject at hand. I became very interested in this problem actually at the Brigham Hospital as a third-year medical student when a young man told me not to go to bed because he was going to go and cut the young man who cut him. He didn't call him a young man, he called him something else, but he was going to go out, cut that guy, and send him into the emergency room. And it was at that point that I realized that I had not been prepared to deal with violence against others. Violence against oneself. If he had said to me, I'm going to go home and I'm going to take some more pills, I had a protocol, I had a strategy. Prevention had been a part of our training. And so everything from lead poisoning to heart disease, I had a protocol, I had a strategy. But with violence against others and to his risk that he articulated in the emergency room, I had no protocol. So I started feeling very inadequate in that moment and met others who had similar feelings. And together we started this effort to look at violence as a public health problem, to see what we needed to do aside from stitching people up and sending them out. And we made the case that the magnitude of the problem, the characteristics of the problem, which have a lot to do with family and friends, not that stranger bad guy who comes from somewhere else, that the contact we had. And at that point, we were assuming that the application of public health strategies would help with this problem. Now we have pretty good evidence over the last 35 years or so that we can do effective reduction of violence in schools and even in cities. 1985 was Surgeon General Koop's conference on violence as a public health problem. We think that's the first one that we had here as a country. And we were divided into these silos: child abuse, gang violence, street violence, violence against elders, elder abuse. And we've learned a lot since then about the connection between all of those kinds of violence. The other thing is we brought that public health model of primary, secondary, tertiary prevention to the fore and started applying it. Over the years, we've had some successes, and that's been an important contribution, I would say, of public health. We've helped to understand the problem better, but we've also had some successes. One of the things that is illustrative of health and public health, shown in this blue line, is the success we've had around motor vehicle accidents. And so while we've had car crashes go down and deaths from car crashes go down, the red line represents the death toll of firearms in this country and the rates of that. And you see, in the late 80s, early 90s, we had a period of a real epidemic. And you've probably heard in the news that there's been a decline in violence across the United States, and that's true, and you can see that. At the same time, it is not the dramatic decline of car crashes, nor is it the dramatic decline that we think is possible when you look at this problem as a preventable problem. And interestingly, there is an analogy between firearms and automobiles that just is worth keeping in the back of your minds, because it was the regulation of automobiles that contributed tremendously to that blue line and that decline that we've experienced. But if we look at firearms and their impact on health and life and limb and death in the US, it becomes very clear that we have too large of a problem. Now, one might say one death by homicide is too much, or one death by suicide is too much, and I would agree. But we stand out among industrialized countries like a sore thumb, and firearms have a lot to do with that. Every year we have about 30 to 35,000 deaths, and the majority of those actually are from suicide. 2/3 to about 3/5 are actually suicide deaths. But it's not just deaths. And about 85,000 or so every year people are injured with guns. And our number of children injured with guns is another factor that just makes you want to say, okay, what can we do about this? Well, public health has helped us to understand the risk factors. Epidemiology applied to this problem has revealed quite a bit about the problem, its geography, where the risk lies. And access to guns is one of those issues, and we'll talk a little bit more about that. But I also want to talk about the culture of violence a bit, because probably for me, one of the most robust of the risk factors that I've learned over the 30 plus years of thinking about this problem is this issue of culture. We did see a rise in girls and women participating in violence, not so much with guns yet, but certainly other indications. And I think as a culture, those messages are important that we've given our girls and women. But the big issue that brought this culture item to my attention was the history of dueling in the United States. And interestingly, according to Fox Butterfield, some of the rates of homicide from dueling reached 18 to 20 per 100,000 per year. Now, if you think back to that slide where we were looking at car crashes and firearm deaths. That rate was about 10 per 100,000 per year. So what we experienced as a country when it came to dueling was quite significant. I like Harriet Martineau's notion that, there were, in 1834, more duels than there are days in the year, 15 in one Sunday morning. This was in New Orleans. She was in New Orleans. But this was a cultural phenomenon. People often gathered to see these. The appointed time was often Sundays where families could come to watch. I don't know if this is true, but I've heard that our history of ambulances has to do with doctors going to duels with their carriages. I haven't seen it except in one place. I don't know if it's true, but it's interesting to think about the kind of phenomenon that these duels actually were. On the right there is one of the ways that a duel started. And this is a placard posted by William Tradewell saying that General Lee Reed has declined giving him an apology for the insult that was made against him, and he pronounces him a coward and a scoundrel. When that happened, the dual process began, and the seconds would start messages back and forth. An apology could stop the process, but often didn't, and led to a duel. I don't know if you've seen Hamilton yet, but Alexander Hamilton's duel, I think, is particularly interesting because his son was killed in a duel 3 years before he was challenged by Aaron Burr. So even though he knew the pain of losing life in your family to this thing called dueling, and he listed out the night before in his diary the reasons why he shouldn't duel, the reasons why he should, those pros there, won the day. So this is a man who, was founding father, treasurer. This was a man who was an elite gentleman in this society who, excuse me, who because of his love for his wife and children, because he didn't want to leave them in debt, because he really didn't have bad feelings about Aaron Burr, because it was illegal, a lawmaker, because it was illegal and condemned by his religion, which was Christianity, he thought he shouldn't duel. But that peer pressure, the pressing necessity to not decline the call, that's what got him to wake up that next morning and take that boat to Weehawken, New Jersey. And as you know, he was killed in a duel with Aaron Burr, which is another very interesting aspect of this story. But the peer pressure, the political support, that's kind of like a kid saying, my posse won't hang with me if I don't fight. Essential to his ability to be useful in the future. That was also a very interesting reason that he wrote, sort of like they're going to beat me up every day if I don't fight. Very interesting context when you think about culture. And the illegal part of this was something that was the case across the United States. When I appreciated dueling as an American phenomenon and its decline as an entity, I became very curious about this thing called culture. Women were told they shouldn't marry a man unless he'd proven himself with the blade. This was even before the dueling pistols were created, twin pistols for the purposes of dueling. So this cultural importance, or this cultural factor, is important to keep in the back of our minds when we think about the demographics of violence. In fact, Fox Butterfield claims that it was in the dueling and the dishonoring that many of the freed slaves took dissing to urban America, and that became a similar phenomenon in urban America. Very interesting hypothesis, but again, for me, it's just indication that culture matters. Now, I would say to you that, in the late 80s, early 90s, when we as a country had an urban black and brown poor young man epidemic of violence, we did not pay enough attention. And that much of what we're experiencing as a society today is a reflection of not paying enough attention. It's interesting, this phenomenon of canaries in the coal mine and its metaphor for ignoring the most vulnerable when we have an epidemic and allowing it to progress until mainstream, if you will, is impacted. And this gun issue for the United States is so thick, and that's probably my best word for it, it's so thick that not only did we ignore the urban black and brown young men, but even Sandy Hook, I got really depressed after that because I thought, okay, if we don't change our laws after this middle class, suburban, white, elementary school with these young, beautiful children, if we don't change our behavior, wow. Now I'm energized again because of the teenagers, and we'll get to that. But there's another place where I think we're ignoring the canaries in the coal mine, and I want to raise that now, and that has to do with the policing items that have come up regarding young men of color in the United States. Basically, the police and young black men and young brown men in the United States. Now, this is an 1851 poster. I got it from the the African American Museum right down on Joy Street in Beacon Hill. But it reads, "Caution, colored people of Boston, one and all. You are hereby respectfully cautioned and advised to avoid conversing with the watchmen and police officers of Boston." And it goes on to say that they are recapturing fugitive slaves. The city ordinance has said that is now their responsibility. And they're saying, don't speak to them. Don't shun them in every way, I think is the language. Keep a top eye open. This was an active assault on the free black community here in Boston, and those fugitives, you might have seen 12 Years a Slave, but those fugitives who made it, well, the police were enfranchised to recapture them. So the relationship with the police and the black community in particular is one that has to have very sensitive attention. It's a very important relationship, and this history is extremely important. When I started doing this work several years ago, like 30, I guess is now, it was 78, so that's actually more than 30. I have to stop saying 30. I noticed that despite the up and down of homicide rate, there was one category of homicide that never changed. There seemed to be no change in that category, and I kind of ignored it. It was called justifiable homicide, and it was the killing of a felon by a peace officer or a police officer in the line of duty, or the killing of a felon during the commission of a felony by a private citizen. And this category of justifiable homicides has been with us. And I have to confess, I pretty much ignored it because, the police are supposed to deal with felons, and, if some of them get killed, well, that's what we've asked the police to do. That was my thinking Well, thank God for iPhones and the cameras, because now I appreciate that this number represents another manifestation of what we now understand as part of the problem. And it was very interesting to sort of appreciate that. And you know the stories. There are about 400 or so a year, each year on that slide I just showed. This is a Washington Post article about 1,000 in 2017. I don't think we even have the right epidemiology of this now, so we don't really know. But you and I have seen enough video footage to know that we've got a problem as a country. And, whether it's, Eric Garner or the most recent young man in Sacramento, it really represents a need that we have as a country. And I love this quote. First, they came for the socialists, and I did not speak out because I was not a socialist. Then they came for the trade unionists, and I did not speak out because I was not a trade unionist. And then they came for the Jews, and I did not speak out because I was not a Jew. Then they came for me, and there was no one left to speak for me. This canary in the coal mine situation that we have with policing and young Black men is one that deserves our attention. And now that we have the knowledge and the empathy to appreciate that in many of these situations, it is not the felon committing a felony, but it is another kind of very tragic remnant of racism and slave history in America. You and I have to do something about this. It's part of our challenge. Well, now we are paying attention to the school shootings, and I think we have an opportunity. I think we have an opportunity. These teenagers have not only energized us, but let me tell you what they've gotten right that I had not seen among survivors before. They are cutting across race and class and geography with an intentionality, and there's a new word for it now, intersectionality. But they are doing this in a way, if you watch them presenting at the march, their speeches, their recognition of privilege, their recognition of race, made me very, very hopeful. And actually, we were able to witness a bit of a success. Now, this Florida gun bill is not the end-all be-all, but it happened. This subject was discussed. And, I was there before 94 when we were working on this issue and passed the assault weapon ban. But not much had happened since it expired in 2004, and not much happened since then except a bit of backlash. So when this happened, many of us said, wow, we have an opportunity. We have an opportunity as a society to think about what we want and don't want as a society. Now, the NRA, you may not know, was actually started because the Union troops didn't have marksmanship capacity, and people wanted the marksmanship of the troops to improve. It has obviously morphed tremendously since then. And when we passed the federal assault weapon ban, which was signed by President Clinton in 1994, a lot politically had happened. One of the major factors was a shift in the police perspective on assault bans. So for the first time, police were testifying for a ban on assault weapons. And that was a pivotal point in that discussion. And even though Senators Leaded and Dianne Feinstein was a major contributor to that, author of the legislation, it was policing coming to the table in their organized associations that made a difference. So I recently was at a roundtable with Dianne Feinstein, and my refrain became, we did it before and we can do it again. But we did this. We banned assault weapons at the federal level. And there's a lot of debate about the impact of this ban. But one of the things that's pretty striking here is in 2004, when it expired and Congress didn't renew the ban, you start to see an increase in these mass shootings. And the fatality of the mass shootings in particular is what I think is most striking there. And, you know, it's somewhat pedestrian at one level to think about why we don't need military weapons. You know, it's just, you know, it's bizarre. But, you know, for those of us who've been in this fight for a while and want now to continue it as we see this opportunity created by our teenagers, I think it's important to recognize that not only can we do it, but it matters if we do it. And I think that is sometimes hard to appreciate when the news is so bad or when things continue to happen. But we have information. Now, Art Kellerman and Garen Wintemute and David Hemingway here at the Harvard School of Public Health are some of the heroes of the understanding of guns and their relationship in this society. And interestingly, this article showed us that having a gun in your home, even though most people have it for protection, actually increases the risk of homicide by a family member or intimate acquaintance. Important information for us to know. And then you want to know things about that gun, how it was kept. You want to know more. The epidemiology of this is, you know, compelling for those of us who try to prevent problems. But this article actually became the source of much of the backlash. So 1993, it was published. 1994, we passed the assault weapon ban, and then we had the Dickey Amendment. And what that did was basically say it took $2.6 million out of the CDC budget and said they can't promote or advocate for banning firearms. Well, that's what was said, but it translated into no more funding for firearm research out of CDC. So really, it matters what we do. And like the issue of race, we can't stop. Our successes are fragile. And this is another example of one that, you know, had a backlash. But this is a more recent paper. This is March of this year by a woman, Eleanor Kaufman. And not only is it extremely important, but it represents some of the robust work coming out again because private foundations did step up a bit in that CDC void of funding. And her conclusions, I think, are really important here. Strong state firearm policies were associated with lower suicide rates regardless of the other state laws. Strong policies were associated with lower homicide rates, and strong interstate policies were also associated with lower homicide rates where home state policies were permissive. Strengthening state firearm policies may prevent firearm suicide and homicide with benefits that may extend beyond state lines. So the colors here are interesting. California is a very dark blue because it has very high policies against firearms. So it rates very high on the policy scale, but it's right next door to states that rate very low on the scale. So that dark blue is right next to Arizona and New Mexico there. So the impact across state lines is what this article also measured. A very important new way of looking at this, but also saying what we do at the state level can matter a lot while we try to do this ban again. Well, we're back in the game. The American Academy of Family Physicians has put out a call recently around this issue of gun violence. As I said, Feinstein's back in the game. She hosted a group of people in Los Angeles. The city attorney in Los Angeles is revved up. And again, California has some of the better laws when it comes to issues of guns and gun violence. It is, I think, for me, the theme is we've done it before, not to the level that we needed, but as evidence that we can, and we can do this again. And we have a very ripe opportunity with these teenagers who are talking to us about privilege and about race and about geography in a way that has to inform our public policy if we're going to sustain these successes that I'm sure we will have in the future going forward. So thank you. I am honored again that you invited me to be here with you.
So we have a few minutes for questions and comments.
Hi.
Hi, how are you?
Good, how are you?
Can you reflect for a moment on where you've been here in Boston and where you are now in California in relation to not just your perspective on youth violence, but also on your voice, on the power of your voice to begin to address, or I should say continue to address gun violence?
Well, one of the things I was actually saying to Senator Feinstein in that picture was that after Sandy Hook, I really became very depressed. I withdrew a bit from this subject because I had become convinced that we were not going to do anything as a society. I had made every case that I thought could be made. I'd heard brilliant people make even better cases across the country, and we were not. And in fact, when I heard the NRA call these parents actors, it just, the nastiness of that was just cut very, very deep. So, or very, very deeply. It's hard for me to answer your question because I've been in a different place over, I would say, the last 10 years or so, and now am becoming inspired that we can do this again and do more. I think we can do more. I'm pleased that the private foundations like the Joyce Foundation stepped up and started funding gun violence research. Obviously, they didn't have the money that CDC had at the time, but NIH has started raising firearms as part of its research portfolio. So I'm optimistic that as we get more and more information, we will move forward. So I am entering the fray again, and hopefully my voice will get stronger and stronger as I get back in and understand many of the dynamics that have taken place over the years. But LA is a great place politically to be involved in this issue. As I mentioned, California's gun laws are held up as models throughout the country. And I moved from a blue state to a blue state, so I feel comfortable politically in that context. Though Orange County is very red and it's very close, and Nunez is somebody. Well, that's I won't.
We don't want to go there. But I want to follow up on that question because you're dean of a medical school and you did a lot of your work from a school of public health. What is the role for us in medical education and in training physicians to be able to deal with this?
I think that's so important because I did become very disenchanted in the emergency room in 1978 when the kid told me that he was going to go out and cut the guy who cut him. And I became disenchanted because, and I actually became quite angry after that because I had come to Harvard Medical School to serve urban adolescents. And what I learned after that experience was that homicide was a leading cause of death for young Black men. And I just got angry because I was in a lot of debt. This was my third year of medical school. And the leading cause of death for a population I wanted to serve had not even been mentioned. It was not a part of the curriculum. So I think we have a huge responsibility there. And I loved, you may have seen it there, David Satcher's quote saying, well, if it's not a health problem, why is it killing so many people? And at one level, I think we do have to better incorporate issues of the social determinants of health into our medical school training. I think we have to start thinking about health more broadly. It's exciting to be back in the medical school context because of the opportunity to do that. I was asked to do one of the name lectureships at AANC about, it was 2003, I think. And I said, you know, I've looked at health from both sides now, meaning public health and medicine. And neither one of us has this right. We really have to get together and start talking about health. So I feel like I have an opportunity to do that in our curriculum, but that's a very important question for those of us in medical schools.
Here's one last question. I saw a little hand like that.
I think she's giving the mic over.
Okay, I'm going to go for it. My name is Lanny Smith. I'm very interested, kind of following up on this last question, because I think that the interrelation between what we're teaching medical students and public health students and the reality of our United States and the rest of the world is it's at a crossroads. There was an article a few days ago in The Guardian that took an appraised look at Harvard Medical School and other medical schools regarding social justice, white coats for Black lives. I'm sure most of you have read that. And I'm wondering what the opportunities are, you as Dean of Charles Drew and Dean Daly here, what can we do to work together to reform our curricula so that when we are looked at a few months from now or a few years from now by White Coats for Black Lives, we both come up with a grade A?
That's also an important question, and I'm going to ask Dean Daly as well if he wants to respond. I think that to be successful in transforming communities and addressing social determinants of health and the issue of race in America, we're going to have to reach outside of the health and public health communities. And for me, the civil rights movement is an example of the kind of cultural transformation or strategy for cultural transformation that we need, not only professionally, but as a society. And I think there's some very hopeful parts of medical care and training and very hopeful parts of public health care and training. I think it's in the interface that we will have more success, but the most success will come when we start understanding the media's role in this, the churches and faith institutions and their role in this. At Charles Drew, we have a community faculty. They've been a part of the university since its origins. And the university was started after the Watts Revolt in '65. So we're in our 51st or 52nd year now. And so the community owns the university in a very interesting way, and that gets manifest in some very concrete ways. I would offer probably not as much a part of the curriculum as one would argue, but the social justice curriculum does include these faculty who are heads of the community agencies who are changing policy and practices. So I think we're going to have to reach outside of medicine and public health to really have that transformation as a society. But our data collection, our advocacy, and our ability to identify and support and provide a platform for many who are affected by these problems represents that list is strength we bring to the table. And so we can catalyze this. But Tina Cherry here in Boston, whose son was killed 20 plus years ago, started the Louis D. Brown Peace Institute, is the kind of advocate that just grew out of academic support. The Harvard Violence Prevention Center provided the platform and the information, but she became the messenger. She took it to the governor. And that's the kind of partner, I call it looking for roses, as in Rosa Parks. But we have that, we can collect the data and we can really understand the problem. We can start, evidence-based policies and practices, but that partnership with those who can really take it to the public, to the level of being able to transform this society, those are the partnerships that we will need. Thank you.
Thank you.